Direct from Foxborough, Massachusetts, the gem of Norfolk County, and taped at the studios of Foxborough Cable Access. It's Foxborough Central. And here's your host, Bob
Hickey.
Welcome
to another episode of Foxborough Central. I am Bob Hickey, your host. Thanking you for taking a little bit of time to join me and my guests as we talk about the people, events, and organizations that make Foxborough the gem of Norfolk County. Of course, sometimes when we're talking about organizations, we're not talking about ones that are in Foxborough, but we're talking about organizations that affect Foxborough, who we are, and in this case, how we as a nation live. And so I am pleased once again to be joined by my guest, Major Joe Rolanitis with the Food and Drug Administration.
Bob, it is a great thing to be here in Foxborough. I couldn't have found a better place to be and a better group of people to be working with.
Well, thank you, volunteers of Foxborough Cable Access. Appreciate your coming down here. All the way, your office is in Worcester.
It's in Boylston, actually.
Boylston,
yeah.
Outside of Worcester.
Yeah, it's a Worcester resident post, and it's a government, and we're in Boylston, and we just take the name of the biggest, nearest city, I guess.
Well, there you go.
Who we are.
But we're in your region,
Yep.
and so you're covering us for what? What exactly is it that you do with the Food and Drug Administration?
Well, I'm a public affairs specialist for the FDA, and that's the guy that gets out and does the wonderful shows on cable access, on radio, talks to student groups, industry groups, sort of gets the message that the FDA is doing this and doing that out to your viewers. Your viewers, of course, are my consumers, so we really do have the same audience, and that's what we do.
Well, it's great that you took the time to come down here because, and I always, and folks who are fans of Foxborough Central know that I've had Major Rolanitis on a couple of times before to talk about things. And every time you come down, there's a different topic, and you're so knowledgeable. And something that I have been wondering about, and I suppose many folks in our audience, this has been a particularly interesting flu season.
It has.
Because, and depending upon when you're watching this, you'll know that we've just wrapped up a season where I think the headlines were that the flu vaccines that were created weren't exactly a match for the strains of flu that people encountered here in New England and in Massachusetts in particular. So if you have a little bit of time, I'd love to start off talking about that.
Sure, well said, and that's true. The current flu vaccine is about 40 to 45% effective against the flu virus that is out there. It happens.
Why?
Well, the virus mutates, and when it mutates, it changes its whole makeup, you might say. Its virulence changes a great deal. And as we pre-produce the vaccine prior to the October to May flu season up in this hemisphere, a mutation can really change. It's a game changer. It really does change the game. So this happened.
But you say pre-produce. You can't just go to the store and just get a new flu vaccine?
No,
Doesn't it just happen that way?
I wish you could.
Just magically happens.
No, that'd be nice. It takes some time to get it all right. Clinical trials are not part of the equation because we have a good track record. We pretty much know what we're dealing with unless it mutates. So it takes a while to produce and get the stuff into distribution, get it to the facilities that are going to administer the flu.
Now, are these made by the government or are they made by private industry?
Private.
By pharmaceuticals, but they coordinate.
That's right, yeah. Oversight is always found with the federal agencies like the FDA. We check them for effectiveness and safety, which is oversight's a huge job for us. But they're produced by private pharmaceuticals with some input and some guidance from the Food and Drug Administration.
So when a private pharmaceutical, we'll just call it Acme Pharmaceuticals,
Sure.
When Acme is creating their flu vaccine, we'll call it their drug, for the upcoming season, is it a shared data, a shared science? Is there a database that everybody's looking at through the health organizations?
Pretty
or
much.
Is this individual scientists coming up with what they believe is to be the best solution? They submit it to the FDA for approval. How does the whole process work?
Well, they look at the virus in the southern hemisphere or northern hemisphere, wherever they're sampling from. So they look at the virus and they know when the flu season kicks off in this region up north, they know pretty much what to expect. They've been doing this for a long time, so they can bypass.
So it goes southern hemisphere, the northern hemisphere,
Yeah.
southern. So what they're really doing is they're chasing the current season
That's
and
correct.
preparing for the next season.
That's right.
North-south,
That's right.
depending upon the season.
Yeah. get a pretty
But then
good
you're
feel for
saying
it.
that this year there was a squiggle and that mutated a bit more than what they thought it was
Something
going
happened, yeah, and that's not
to.
unusual.
Isn't that interesting?
Yeah, it's always iffy when that occurs. So yeah, you hope for effectiveness. You hope that the mutant doesn't, disturb the distribution and effectiveness of the established and produced vaccine. It happens, but you know what? It's still the advice that we give for everybody. And the flu season can go all the way to May. That's not unusual. It's still wise for people to get the flu shot if you haven't gotten it. The flu is a dangerous thing. We lose about 3,000 people through fatality, Bob, every year because of the flu. And you get hundreds of thousands of people getting sick, children, adults, people with compromised immune systems. So people just suffer through it if they don't get the flu vaccine.
And so the recommendation always is to get your flu vaccine,
Sure.
even if it's only X percentage effective,
That's
because
correct.
that's more than it would be if you didn't get the
That's
vaccine.
correct. Yeah, when you got headache, nausea, dizziness, aches and pains for 2 weeks, you're going to be looking back and saying, well, I should have gone with a 45% effectiveness option when I had a chance to do that. It's just a better health investment, really, to go for the flu shot. Anybody from 6 months up to like 106, if they don't have a reason not to get the flu vaccine, should invest their time, effort, and money. It's so easy nowadays.
It is.
I mean, you can just go to, your health plan covers everything, go to any drugstore, any clinic.
The pharmacies will do it
That's
on their
right.
days, right?
It's a walk-in thing.
My employer does it.
Sure.
They bring in a team and they inoculate. So
Sure. Well, you have to look at the amount of person hours that we lose every year because people get sick.
I was just going to mention loss of productivity,
It's
loss of
huge.
work hours.
Yeah, and you know what? It bothers me. I don't have all the stats yet because we're still wrapping them up. We'll look at the mortality rates. We'll look at the hospitalization rates. And next time I come in and do a show in the warmer months, we'll do a little wrap up on how this past season went and find out how much flu vaccine was not used. And the important thing about coming down here to Foxborough and talking to you and talking to you many viewers is to try to drive home smart behavior, wise investments in your time to maintain your health and productivity. It's just a good thing to do.
Well, we have smart viewers, and we
You do.
appreciate the information. That's why it's always fascinating to have you come down, because it seems as though I can bring up any topic, and you have a treasure trove of information. And as we're talking here about the flu and about the vaccines and how they're produced and the oversight and the collaborative approach, I'm also sort of struck by, all right, maybe I didn't get a flu vaccine, and maybe I'm not feeling so well. I've got a backache. I'm feeling it. What do I do now? I go to the drugstore or to the supermarket and talk to my pharmacist, or maybe I make an appointment with a doctor. But maybe I don't do that. Maybe I just go down to the store and I try to cure myself. And I'm looking at this. America's a great country. You've got so many options. I always think of that every time I go down to the local market, and I just look at all these foodstuffs that I was at the Stop and Shop and they had dried salted pea pods. And I'm looking at this going, wow, that's fantastic. What a country, what a time to live. But I'm now in the drug aisle. I'm looking at the drugs, and I see the generic drugs, I see the name brand drugs. With the FDA and their approval and oversight, what is the difference between a brand name drug and a generic drug? And I'm not even necessarily talking specific to the flu. I know that there's no medication that will just cure the flu. But I'm in there, I'm looking for a pain reliever. What's the difference?
What a great segue, Bob. Really.
I'm going to...
Makes my job easy. Well, you do. You have the brand name drugs. Those are the initial investment and development of a drug. And they get all the publicity, all the clinical trials, a lot of money spent on investing in a new drug for the...
Well, it's expensive.
It is. It's millions, hundreds of
And
millions
you
of
had
dollars.
talked about the trials. You're not kidding. It's a long process to
It
get
is.
approval. And
Years.
we read about in the paper where, and particularly here in the Boston area, where we are a hub of medical breakthroughs and research and development.
A lot of R&D.
We hear and read in the paper about companies who are making and breaking based upon FDA approval.
Sure.
So it's a huge
It is.
investment. You talk about R&D, it's a huge investment of time and shareholder money and the outcomes.
Big industry, yeah.
The FDA has a lot of power when it comes to approval of these.
Regulatory oversight, yeah, it's huge. From southern Maine down to Triangle Park, North Carolina, a huge hub, as you said, of research and development for drug development and medical device development. It's big. And we have oversight, regulatory guidance over all of this. So if you look at the name brand drug, the first drug that came out gets the publicity, gets the market share, but the patent runs out in about 7 or 8 years.
Well, let's pick an easy one that we all know, Tylenol. Tylenol comes out, and it's McNeil, I think, that owns Tylenol. And how long is the patent for?
About 7 years, give or take a couple months either direction. And when that's over, and then you have the company has a chance of doing its own generic, or a competitor can do a generic. Mm-hmm. And the generic gets a bad rap, you might say. It's like, it's like wearing a Patriots hat as opposed to the local high school. We're snobs.
We're all of the opinion that the brand name must be better because it's the brand name.
First, it's the name brand, all the publicity's there. But by law, your generic drug has got to be therapeutically equivalent to the brand name. The active ingredients have got to be the same active ingredients, the same distribution and absorption levels and effectiveness have got to be in place for both the generic drug and the brand name drug.
By law,
by regulatory guidance.
So there's no choice.
No, you have to adhere to that. The things that are different, the shape of the drug can be different. Mm-hmm. The color, which doesn't really matter, is probably different. The inactive ingredients, the ingredients that are the binders and hold
that makes the pill the pill.
Exactly, that can be different. But your amount of active ingredient, which is really the disease or the curative part of a drug, Robert, have got to be the same. So you're spending a lot less for the generic. It doesn't have that name brand recognition. It didn't have to spend a lot of money in clinical trials because the clinical trial data, which, as we mentioned earlier, was very expensive, is already done. So you're saving a lot of money. In fact, Americans save, I think it's like $8 to $10 billion a year by investing in generic drugs. They're as good as. You'll hear the argument against them. Sometimes people react different to different colors. Sometimes it's a psychological thing. They just feel more comfortable with the name brand drug over the generic. But from a clinical standpoint, safety and effectiveness is there, and FDA oversight is really rigorous when it comes to looking at these medications. It has to be.
I'm here again with Major Joe Philonitis, who is with the Food and Drug Administration. He's sharing with us information about this past flu season, and we're now in a really interesting conversation about generic drugs. And if you don't mind, I'd like to stay on this topic. Sure. Because I find it very interesting. We, as Americans, you mentioned the psychological, maybe the feel that
snob
I
appeal.
need. The snob. That's a great way of putting it. But is there truly absolutely no difference? Because we see commercials, and we see the commercials that are touting the brand name versus the generic, and everybody should view any information with a dose of, I won't say skepticism, but just to be informed, who's funding a study, who is funding a commercial, what is the intention? It's to get you to buy, to purchase, sure, to use, and that's what a commercial is supposed to do. So a commercial, by definition, is not supposed to be giving you your choices. However, and I don't know, and I'd like to touch on this if you are comfortable doing it, but you see the commercials on television, and it seems as though the first 15 seconds of a 60-second commercial are talking about the drug itself, not exactly telling you what it's for. I'm not sure I understand why. I guess we can talk about erectile dysfunction as being one that we all see on the television. You'll see people holding hands in a bathtub, not really understanding what the whole point of the commercial is. And then for the next 40 seconds, they go on about the potential side effects, right, including oily discharge and blah, 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 sure, blah, blah, blah. And then the last 5 seconds, and of course, consult your physician. So buy this, and
Right.
You can hold hands in a bathtub. And I use this as an example. I don't even remember the name of the drug, so please, I'm not endorsing or making fun of anything at all. These are the things that stick in my mind as we're here on television with no script. Hi, I'm Bob. But how does the Food and Drug Administration play into that, and what regulations are they really trying to touch upon? And also it's true in magazines. You'll see the ad on one page, and you flip the page, and you've got another page of disclaimers and
contraindications. Sure.
Exactly. So let's touch on that for a second.
Great issue.
And then we're going to roll it back to how do the generics then touch into this?
It's guaranteeing an educated consumer, which is, there's nothing better than that in a democracy in any country.
But I want you to buy my drug. Why am I educating you?
So that you can have, I guess, patient satisfaction. The FDA has its place to stand already. We're the regulators. We guarantee safety and efficacy. That doesn't mean that there won't be problems with the product that these individuals sell, the drug companies sell, and that the buyer uses. That's where the FCC and other regulatory agencies require the long list of contraindications, or the verbal contraindications that you hear and see on your television, radio ads, and your pharmacist taking time to explain what could possibly be problematic by using either an over-the-counter drug, a generic or brand name, whatever the case might be, a prescription drug. It just gives people looking for a market share if you're in that industry. If you're the healthcare community, a sick consumer, or a regulatory agency, you're trying to assure patient awareness when they use the product. That's what you have to do. So you must explain, and we all know this, that we guarantee a certain degree, or we enforce a certain degree of effectiveness, but there's always a risk. The benefit will outweighs the risk, but there's always a risk thing. So the best thing here is to give your viewers a good, objective, full-scale look at what the product is and what it can and cannot do, and what to expect. Important.
So that is with a brand name medication, and they're trying to get absolutely trying to get market share. They want you to buy, and they have to meet certain regulatory obligations through education. I get that. So now we get to the generic, and let's take erectile dysfunction, and let's just say we're a few years down the road, the patent is expired, and now there's an alternative. There's a generic form of the drug. What are their obligations?
Same, great
But are they even doing the advertising? Are they just glomming on to the advertising from the brand name?
I don't really know. They don't oftentimes have to advertise as much because they do the same basic thing.
Because they're the generic. They just say,
they're the generic.
We are alike.
Yeah, and we do this.
Or similar to.
Yeah,
or
and we offer this type of curative effect. So they dodge the need to advertise, but they're required, Bob, by law, by federal law, to have the same quality product, and the ingredient listing, point of contact, safety and efficacy studies, and so forth. They have to do that. So whether you're a generic or a brand name, you're really bound by some strict federal laws as far as quality of product go.
Now, earlier in the discussion, you had mentioned regarding the generics that sometimes the brand name company will also make the generic version.
That's interesting. Yeah, it's an interesting paradigm, isn't it?
Yes.
Yeah.
Can you touch upon that? I'm interested by this.
I mean, who would know better than the person who produced a very popular, well-selling, well-thought-of brand name drug? And when the patent is gone, 7 or 8 years later, why not just get the whole market by producing the generic as well? And they do that. That happens. It's capitalism. It's free enterprise. It's our option to choose and pick what we want to use from who makes what we use. It's just the way the system works.
That's interesting, and part of it in me it feels good about it because I would like to think that if Acme Pharmaceuticals makes drug A and then the same company makes drug AB, that it'll be high quality control. But you're saying that by law there can't be a difference in the quality control anyway. So now we get into what is the competition? So say maybe I am Acme Pharmaceuticals and I make my own generic. Can another company come in and also make a generic? Can there be competing generics?
Sure, you can do that.
So it is America, and it's free enterprise. So once your patent expires, it's expired for everybody.
Yeah. The good thing about, or the optimum thing about owning the name brand drug is of course you have all the clinical trials at your disposal, all the research data is there, and as you mentioned earlier, rightly so, it's expensive to make medications. That's why it costs so much. But Americans benefit a great deal, Bob, by going generic, and a lot of physicians will prescribe them, and a lot of hospitals will use them. So you save a lot of money, and you're getting the effectiveness and safety from generics as well. I truly think that most Americans should consider the generic option if they have the chance to.
So I'm here with Joe Rolanitis. I'm going to give you the last word because we're almost out of time. I'm going to say in summary that for this year, flu season was interesting. Next year, the flu season will be combated by vaccines that are based upon best science available from what has gone on the prior 6 months during the flu season in the Southern Hemisphere. So for folks who are worried or who say maybe the flu vaccine never works, they're wrong. It's just a matter of science, mutation, and the best work that's with the information available. And then the second piece is that when I go to the pharmacy because I forgot to do my flu vaccine, and I go there, I'm looking in the aisle, I should have confidence that my generics are going to equal the brand name, and I should make the best decision by my symptoms and not by the pre-packaging.
That's
Is that
great.
what you're saying?
Basically, nicely put, and you'll pay less with the generic too. You'll always pay less. You'll save a lot of money. You'll have the same good quality there, and you'll just have to go with that.
Okay, then. Joe, thank you so much for taking
Thanks,
the time
Robert.
to come out with us today. I really enjoyed our conversation, and I hope folks at home have as well. It's been very educational, and that's why we always love having our Food and Drug Administration coming into Foxborough to give us the good information. If for those of you who would like to see us again, maybe you missed something on today's program, you'd like to catch it again, check us out on the web at www.fcatv.org. Maybe you have an idea for a future program, or maybe you and your organization would like to appear. If so, please reach out to me, Bob Hickey, your host. I'm at foxcentral@fcatv.org. You can email me there, or you can stop by our studios at 28 Central Street here in beautiful downtown Foxborough, Massachusetts. And you know our zip code is 02035. I don't even need to mention that. Or stop in the studios anyway if you'd like to volunteer and become a part of the FCA family. On behalf of my family here, Betty Travers and Deb Storrs behind the cameras, Gary Nash behind the glass, and Jillian Larson, who puts us all together and make the graphics fly and make us look pretty. I'd like to thank you for taking the time to join us. Have a great day, Foxborough.